Thank you very much, Mr. Chairman, and I thank the panelists for being here. You know, when we look at the Ways and Means Committee, you would think that we would be looking at ways and means to pay for this. But when subtitle D says to be provided, I just wanted to list some of the suggestions thus far and get your reaction to them. Anyone on the panel want to jump in? One is tax your employer for providing health insurance. 2, tax your employer for not providing health insurance. Tax you for owning health insurance. Tax you for not owning health insurance. Tax you for spending your money on health. Tax you for saving your money for future health-related expenditures. Tax you for drinking soda and other sweetened beverages. Tax you for having an alcoholic beverage. Tax you for making a charitable contribution, tax mortgage interest payments, increase personal income taxes, energy pollution tax as the part of the cap and trade taxes, increase taxes on American companies doing business overseas, increase taxes on domestic oil and gas production, raise taxes on oil or natural gas obtained from the Gulf of Mexico, raise taxes on domestic oil refineries, raise taxes on drilling equipment, raise taxes on prescription drugs, increase taxes on dividend income. And just last night I put, I have about 8 more. I won't go through them, but I can just tell you that Americans right now in this economy are very concerned. Businesses in most of our districts are having their lines of credit called, and when you're talking about this kind of additional tax to cover this kind of health care, when estimates are that if this bill is passed, about 120 million Americans will lose their health care, I don't see where this is a win-win situation. And I would ask, and I apologize, I don't, Ms. Politz, and I'll just go, from one end of the panel to the other end, because I obviously will run out of time. I'd like to have your reaction to this.
Actually, if you wouldn't mind, Congresswoman, I would defer to Dr. Holohan. I know they're doing some research on options for funding health care.
Okay.
Well, that was a pretty amazing list. I think some of those things have to be on the table. I think what we call sin taxes, I think a cap probably starting at least at a high level on the employer exclusion, and some of the other things that you mentioned. And we should exploit all the possibilities for savings that we can, including trying to reform the way we deal with chronic illness. I just want to make a point, because the issue of the cost of reform has come up several times. There is a huge cost if you do nothing. We published a paper about a month ago called Health Reform, the Cost of Failure. If there is nothing, no reform, the number of uninsured could go up into the mid-60s, 65 million roughly, in the worst case. The employer-sponsored coverage will drop quite a bit. The number of people going on in Medicaid will expand. That's cost to government. The number of uninsured will mean more uncompensated care. That will have to be financed. Employer spending.
Sir, did you miss the part about 120 million will lose their coverage under the proposed plan?
No, that's not possibly right. That is ridiculous.
That's not possibly right.
It's ridiculous.
You think it's ridiculous? Well, sir, I really think that employers will be dropping their plan because the 8% may be.
But they offer now when they pay no penalty, right?
If they offer now, there's still a question about if someone is covered by the spouse's plan and also the percent that they cover of the employee's plan. So I think we need to be very careful where we go with this. Dr. Gratzer, I'd like to hear your comments.
With the 120 million figure, by the way, that you've just quoted is not something, as you know, out of a right-wing think tank or plucked out of thin air, but it was a Lewin Group analysis. I'd also point out that Professor Jacob Hacker, who really came up with this idea of a public plan option, he called it Medicare Plus, as you'll recall, in fact had worked with the Lewin Group about 10 years ago or so, as he designed this specifically to pluck more than 100 million people out of the private insurance market. So to suggest that that estimate is wrong, I mean, it's designed to compete with and overshadow eventually the private system. Now, as for your list of taxes, I would simply say that we're all concerned about health costs. It's curious how much more we need to spend and how much more we need to tax to get those costs under control. Needless to say, I share your bias. We need a more focused plan that directly helps the uninsured who need help, and a more innovative plan, for instance, with uncompensated care, trying to get over to the states to let them innovate. But certainly spending so much money that even Paul Krugman says, well, it's not as much money as the Bush tax cuts, is hardly a great plan for us to endorse.
Thank you. I see my time has elapsed. With that, I yield back my time.